So I have seen this every day this week and last week in one person. Do you know what it is? Usually people come in, they have this hyperpigmentation on their cheeks. Nothing is working. Chemical peels don't work. Medication, nothing works. And the reason it doesn't work is because this is a form of Acanthosis nigricans. Now, Acanthosis nigricans is basically a symptom related to insulin resistance. And typically when you look in the media, they show you Acanthosis nigricans as darkness in the neck area or the underarms or the groin. But believe it or not, this is how it shows up on the face for some people. I see a lot of patients of color, so this is how I see it. But yeah, if you have this darkening in this area right here, it's insulin resistance. And unfortunately, chemical peels, lasers, all of that, it will help it slightly, but it will come back. So the way to treat this is always going to be with dietary changes, lifestyle changes, weight loss in some people. It's the only way you can get rid of Acanthosis nigricans on the face. But yeah, I thought it was interesting, so I wanted to share with you guys. You guys are so funny. So many people in the comments are saying that they thought that was their natural contour, but no, that is Acanthosis nigricans, and I'm going to show you a few more examples of it. So you can see, again, it's really subtle. If you're not paying attention, you won't notice it, but you can see the darkness right here on the cheeks, and this side is darker because this is the side that she gets more sun on. And again, you could see it on this side. This is on the other side, so it's not as apparent. Let me show you another example. And this is somebody I did a chemical peel on. And if you look at the left, it's much darker. That was before. And on the right, you see that her skin is cleared up. But right in that cheek area, it's still pretty apparent. It got better, but you can still see the darkening as well. So no, it is not your natural contour. It is a sign of insulin resistance. So this is commonly associated with obesity and insulin resistance, but it can also be due to some medications like birth control can cause this. If you're taking insulin, estrogen, things like that. Of course, it's also associated with PCOS. And sometimes it shows up as a sign of autoimmune disorders. Rarely it can be a sign of cancer or malignancy. So whenever you do see this, I tell patients all the time, just go to your doctor, at least get basic blood work to make sure that it's not like a pre-diabetes or something else that's going on, but it's not normal. It's not nature's contour, okay?